We are live.
Hello. Hello, everyone. Thank you for joining us. We are going to get started. Unit Chief, Mental Health and Substance Abuse, PAHO, WHO, Dr. Renato Oliveira E. Souza. Advisor, Mental Health, PAHO, WHO, Dr. Claudina Kitano. Department of Psychiatry, McGill University, and Director of the Collaborating Center, Dr. Mark Laperta. HCC Advocacy Officer, Childhood Obesity Prevention and Coordinator of Healthy Caribbean Youth, Ms. Danielle Walwyn. New Advisor, Non-Communicable Disease at the PAHO WHO Subregional Office. All valued colleagues, specially invited partners, and media personnel. Hello, good morning to you. I'm pleased to moderate this morning's session on the launch of the Handbook Promoting Wellbeing and Mental Health in Schools, which is an evidence-informed and self-learning guide for a tutor-led course to build skills of primary school level educators. My name is Avi LeBlanc. I'm an international consultant in communications attached to the PAHO Subregional Office. We have an exciting and insightful lineup for you for our launch this morning. We will begin with opening remarks from Mr. Dean Chablis, PAHO WHO Office of the Subregional Program Coordination, Caribbean, followed by Dr. Ronaldo E. Souza, Unit Chief, Mental Health and Substance Abuse, PAHO WHO, who will tell us a bit about promoting well-being and mental health in schools. Then Ms. Danielle Walwyn, Advocacy Officer, Childhood Obesity and Prevention, and Coordinator of Healthy Caribbean Youth, would expand our knowledge about advocating for mental health and inclusion in schools. Then Dr. Claudia Keteno, Advisor, Mental Health, PAHO WHO, will take us through the next steps for this project. And Ms. Cheryl Dennis Wright, International Consultant, Non-Communicable Diseases and Mental Health, PAHO WHO, will give us closing remarks. You'll be invited to ask any questions afterwards, and our panel will be happy to respond to them. So without further ado, let us begin. And I will now send over to Mr. Dean Chablis, who will deliver opening remarks.
Thank you so much, Ave, and good morning to colleagues, partners, as well as media friends who are online. I would just note, Ave, briefly before I start, that there are a few questions in the Q&A. One of them is, will there be translation for this session, and the other is, will there be a recording of the session? So perhaps we could answer that first before I begin. Does anyone have?
We don't have translation for this session, and the recording will be available on our YouTube channel, which is PAHO TV, and I will write that on our chat for everybody. Okay.
Okay, thank you so much, David. I really appreciate that. And I do regret to our colleagues who are online that we did not have translation. I saw that the comments were in Portuguese, perhaps from Brazil. So with that, I will go ahead and make some brief opening remarks. Once again, good morning, everyone. I'd like to invite you this morning to join me in reflecting on how much of our childhood was spent among educators, in school classrooms, and in other educational facilities. Thinking about how influential those educators were in our lives and how inspirational they were. And now, can we imagine an early childhood education curriculum that is designed not only to provide critical academic and social skills, but also to sensitize learners about well-being, mental and socio-emotional development? It would lead to a healthier and more self-confident society, would it not? That is what we're working towards today. Colleagues, I am proud to bring you opening remarks as we launch the Handbook Promoting Well-Being and Mental Health in Schools. This is an exciting and timely initiative. The attractively illustrated handbook was designed to provide an evidence-informed self-learning guide and primary source of information for a tutor-led virtual course, training educators on mental health literacy in primary schools via the PAHO Virtual Campus for Public Health. Congratulations to the team who spearheaded this project. My colleagues at the PAHO Subregional Coordination Office for the Caribbean, the PAHO Mental Health and Substance Use Unit, and the PAHO WHO Collaborating Center for Research and Training in Mental Health at McGill University. and the Douglas Mental Health University Institute. It is indeed a fantastic publication that both creatively and dynamically addresses so many critical public health gaps in our region. I will mention a few of these. As we know, prevention of emotional and behavioral disorders continues to be a key global public health priority. It is well documented that evidence-informed psychological, behavioral, and social approaches significantly contribute to positive mental health, reduction of risky behaviors, mental disorders, self-harm, and indeed suicide. Though existing studies have highlighted that over 50% of mental health problems begin in childhood, our observations reveal that most mental health initiatives tend to focus on secondary education teachers, teenagers, and adolescents. Our primary goal is to ensure that effective and informed initiatives are designed to address mental health throughout the life course. This handbook targets primary level educators and primary school children, and therefore bridges a critical gap in existing educational materials. PAHO's Regional Plan of Action on Mental Health includes the development and implementation of programs for the promotion of mental health services. This includes initiatives related to the investment case for non-communicable diseases and mental disorders, recently completed in Suriname and presently being implemented in Guyana. The project features research conducted by PAHO, Suriname's Ministry of Health, and UNDP. The results demonstrate convincing evidence for investment in preventive and control measures across the human life course, thus reducing the health and economic burden of NCDs and mental disorders and improving access to care. The study also highlighted that increased productivity from improved health and well-being would spur economic growth. That is why the development of this handbook not only hastens our achievement of regional public health mandates, but also contributes to the well-being and socioeconomic development of countries across the region. As I mentioned, children spend a good part of their daily lives in schools. Therefore, including initiatives aimed at improving mental health literacy during children's time at school becomes a key strategy, particularly as it is imperative to establish the foundations of mental health, promote well-being and socio-emotional development at an early age. This also helps to reduce stigma surrounding mental disorders. We are therefore happy to have fostered the development of this handbook, which also outlines emotional and behavioral disorders as major contributors to health-related disability in children and youth. These disorders are associated with premature mortality, including by suicide, and long-term negative social and economic consequences for individuals and societies. In closing, I reiterate the unique opportunities that schools have to identify and support children who are experiencing emotional and behavioral difficulties. This innovative handbook and training package will develop the skills of teachers, administrators, and other educators, and support the integration of mental health literacy into our elementary schools. Congratulations again to the team, and I look forward to following the full rollout of this initiative. Thank you very much, and back over to you, Abby.
Thank you, Mr. Chambliss. We are indeed very excited about this project. And I just want to extend some thanks to all media and communication focal points who have joined us, and everyone who has just joined us, welcome. And I would send the mic over again to Dr. Renato Isuza, who will tell us a bit about promoting well-being and mental health in schools. Dr. Renato.
Thank you very much, Ave. Good morning, authorities, partners, and colleagues. It's a great pleasure to be with you here today to talk about such an important topic. We all know that promoting well-being and mental health in the school is so important because childhood and adolescence are critical periods for physical, emotional, and social development. Mental health literacy aims to really decrease stigma around mental health conditions and increase the understanding of teachers, but also students, on how to optimize and maintain good mental health and also improve help seeking. We all know that the quality of the environment where children and adolescents grow up shapes their well-being and their development. Supportive parenting, a secure home life, and a positive learning environment in school are the key factors in building and protecting mental well-being. We all know that early negative experiences in home, schools, or digital spaces, such as exposure to violence, mental illness of a parent or other caregiver, bullying, poverty, they increase the risk of mental health conditions. Conditions such as attention deficit hyperactivity disorder, ADHD, we are hearing about those terms a lot these days, anxiety problems, behavioral problems, and depression are the most diagnosed mental health conditions in children. Some of these conditions, they commonly occur together, and depression and anxiety have increased over time. Up to 20% of youth will experience a depressive disorder by the age of 18. Mental health conditions can have severe consequences for the development of children that can extend to adulthood. I mentioned some of those conditions, but let me also emphasize childhood depression that has numerous negative consequences for youth, including increased risk of drug use, poor academic outcomes, negative interpersonal relationships, and also physical health problems, physical health conditions. For adolescents, depression, substance use, and suicide are very important concerns. 50% of all lifetime cases of mental health conditions begin by the age of 14. And 25% of teens have subthreshold depressive symptoms that really impair their functioning. Therefore, early identification and early treatment of mental health conditions will really reduce their impact and improve outcomes. And as I mentioned to you, the school environment offer a unique opportunity for early identification, prevention, and also for delivery of interventions. The link between education and health has been very well documented. Undiagnosed, untreated, or inadequately treated mental illness can really interfere the student's ability to learn, grow, and develop. You, educators who are here with us today, and educators in the Americas, they play a key role in the well-being and mental health of students in schools, because educators can learn to identify the warning signs of mental health conditions and how they can better connect to students and link them to care. Because, as I said, early support and treatment of mental health conditions can decrease potential adverse consequences for now and for the future. We are introducing this handbook because we recognize that prevention of emotional and behavioral disorders is a regional public health priority, but also a global public health priority. Improving mental health literacy is important to establish the foundations of mental health and to promote well-being and socio-emotional development. By improving early recognition, reducing stigma, and making access to care available. So I thank you very much, all of you, for joining us today and really for making mental health a priority everywhere, and in particular, a priority in schools. Thank you very much.
Thank you, Dr. Renato. And thank you for expanding our knowledge on just how critical it is to target mental health conditions from an early age using the school environment. Thank you. So I just want to reiterate, please, that you have an opportunity to ask your questions after the presentations. So keep a note of it. And as soon as the presentations are over, our presenters will be happy to respond to any questions that you have. So we're going over right now to Ms. Danielle Walwyn, who is the Advocacy Officer at Childhood and Obesity and Prevention and Coordinator of Healthy Caribbean Youth at the HCC. Danielle?
Thank you, Ave, and hello, everyone. So a huge thank you to PAHO for your ongoing leadership in prioritizing and destigmatizing mental health. We at the HCC appreciate the invitation to share our thoughts on how to advocate for the inclusion of mental health in primary schools. I'd like to jump straight into it by asking you to think of Jess, who's on the screen. Jess is 9 years old and is still coping with the remnants of the pandemic. She has a newfound difficulty paying attention in class and making friends. She also has trouble defining her emotions and often feels overwhelmed. Children and young people like Jess inspired the Caribbean Youth Mental Health Call to Action that was spearheaded by the Healthy Caribbean Coalition's youth arm, Healthy Caribbean Youth, during the height of the COVID-19 pandemic. And it really grew to become an initiative driven by youth across the region. So the Mental Health Call to Action, launched on World Mental Health Day 2022, is a document that outlines key asks from the Caribbean youth and would ultimately transform the region's mental health system if adopted. The 4 core asks are leadership, research, regulations, and services, and they were developed through numerous consultations with youth and allies from across 10 Caribbean territories, and they align with global guidance. So firstly, how do you advocate for mental health inclusion in primary schools? Most importantly, you engage Jess and other children, youth, and allies like teachers in the advocacy process who are at the center of the primary school setting. For us, it was important to engage vulnerable groups that may face unique mental health challenges. We engage persons living with disabilities, non-communicable diseases, those from the LGBTQ+ group, as well as Indigenous persons in the development of the call to action. Secondly, it is important to listen to what Jess has to say and ensure that her voice informs action. We had over 50 consultations, which led to numerous amendments to the call to action, but it was all worth it to ensure that we heard the voices of many youth and youth allies as possible. Thirdly, it is critical to ensure that Jess is, or at least has the opportunity to be at the forefront of driving change. Even before the call to action was launched, youth members of the Mental Health Call to Action subcommittee from across the region were preparing to engage with policymakers to determine their commitment to the asks outlined in the call to action. So far, youth have met successfully with policymakers and technical officers in the Bahamas, Barbados, Belize, Jamaica, and Trinidad and Tobago, all of whom have agreed to work with youth in advocating for improved mental health in their local territories. Lastly, it is critical for Jess and other key allies like teachers to be meaningfully involved in monitoring the change happening in her school, or in our case, at the policy level. Jess has a right to grow up in a loving, nurturing, and safe environment with access to quality mental health care and psychosocial support. As a result, she has a right to contribute and access initiatives that are meant to support her wellness, no matter how challenging it may be to facilitate her participation. Promoting well-being and mental health in schools, this resource has the potential to shift the mental health narrative by ensuring that youth-centered or child-centered mental health is accessible to all, and by shaping a new generation that dismantles stigmas and prioritizes kindness and understanding. This resource aligns really well with the 4th call of the Mental Health Call to Action, which focuses on services and personnel to support the mental health and well-being of children, and ensures that these persons are well equipped to support the unique needs of this population. We look forward to building on this work and positively influencing generations to come by taking steps to actualize the other 3 calls focused on leadership, appropriate research, and regulations. PAHO can count on the Healthy Caribbean Coalition and the Healthy Caribbean Youth to support your ongoing efforts to prioritize mental health and well-being and ensure that children and young people are at the forefront. Thank you so much.
Thank you so much, Danielle. And we appreciate so much what you said, the importance to include persons in the primary schools and to pay particular attention to inclusion and to listen closely to all experiences to inform change when advocating for mental health at any level, at the policy level, even at the grassroots level. We appreciate that very much, what you said. Next, we're going to talk about the next steps of this very exciting project that we're launching today. And Dr. Claudia is going to take us through this. Dr. Claudia is the advisor of mental health at PAHO WHO. Dr. Claudia.
Hi, Ave. I think we'll go first to Dr. Laporta, who will take us through the section on how to use the handbook. And then I will be presenting what are the next steps. Thank you. Over to you.
Please.
Laporta.
Thank you, Dr. Claudina. Dr. Mark Laporta will take us through how to use the handbook. So we'll be able to see the handbook, I believe. Would we be able to see some of it? And they have some very beautiful illustrations in it. So Dr. Laporta, please.
Yes, thank you very much, Abby. Thanks, Claudina, Dr. Cayetano. Just very quickly, I want to highlight the fact that we're very, very glad that PAHO has included our collaborating center in this endeavor. And it means, yes, McGill, but it means the Douglas Institute and the director of our Department of Psychiatry, Dr. Turecki. And we are working with the Directorate of Research and University Affairs with Mrs. Larizi here. And I just want to mention them because they've made this possible. And the Director of Knowledge Transfer and Innovation, Sylvain Charbonneau here. And we've worked, as has been mentioned, I think, with scientists and program experts here. Massimiliano Ori, who is a psychologist, researcher here in Montreal, and Annabelle Martin, who's also with the Collaborating Center. So thank you for all that. So I have the pleasure of diving in a little bit more. And I always like to start with comparing with fractures. In a fracture, you can easily identify where the pain is, what it's about, what the functional difficulty is. But when it comes to mental health disorders, it's really much more difficult to identify because it looks like personality elements. It's the way you speak, the way you act, the way you emote, and these things seem to be just part of your personality. So it's very difficult sometimes for people to differentiate. And for teachers, it's a bit of a burden to try to understand that. And so we're hoping that this handbook will help unburden people and give them tools to be able to recognize things a little bit more easily and understand their role in between children who are having the difficulties and the kind of help, the right kind of help that might be needed. So just like in adults, we often miss mental health disorders and people lose their jobs and are often stigmatized, sometimes criminalized. In the same way, as has been mentioned in children, we've realized that mental health problems start quite early and are not recognized because we think that children are immune to this kind of thing, but clearly they're not, and you've had all the evidence presented to you. So it does affect school performance, it affects social performance, it affects family life because it has effects interpersonally, how you are feeling and how you are able to resolve problems, for example, which is what happens with mental health disorders. So schools, because of what's been said of their central role, have a really privileged opportunity to do something, to recognize and help do something about this. So that's really the goal of this handbook. Now, I do want to highlight the fact that the handbook's title is promoting well-being and mental health. So we're talking about recognizing mental illness and about learning to do something about it, but also the handbook is aimed at promoting mental health, which is much more than just not having a mental illness. It's really developing ways of interacting that are going to be useful as ways of living in the world in an adapted way. And that's what well-being is, and that's what mental health is, and that's what WHO's initial vision was about mental health. So I think that it's a beautiful opportunity at this age that we may not always be dealing with someone who has an identified illness, but they may have opportunities to learn ways of dealing with things like microaggressions, dealing with things like, sometimes worse than a microaggression like bullying, exclusion. And I think it gives an opportunity to teachers to model some of this as well. So you were promised to see the handbook. So let me share this. So you already saw the title page, and it's done in a way which may be useful also for teachers sometimes who may feel that there's an opportunity to speak with the children, that the way it's illustrated could be useful for a variety of ages, and I think for teachers to identify that what they're reading belongs to this age group. So as you can see, the summary in our summary, first we talk about the rationale of the whole thing, so the importance of well-being and mental health. And in order to understand whether someone is ill or not ill, you also have to understand what a normal child development would be, so that you can somehow compare to what a standard development would be. And we're very conscious of the fact that this may be worded differently in different countries and from different cultural backgrounds. And there's going to be an effort, obviously, in adapting this to the environments where it's used. And then we want to talk about where the influences are that can affect people's, children's ability to adapt better to their environments and prevent falling into mental illness. And then we have a little mini atlas, if you will, of the main emotional and behavioral disorders. That is a go-to for teachers to help them recognize, what are we actually dealing with here? So I'll go through a little bit of that, but I want to highlight what's mentioned here in the preface. So yes, it can be used as a self-learning guide, which people will want to leaf through and refer back to, and that is going to be very useful. But really the way that we're seeing this is more as a tutor-led training program that can be done in different countries or virtually, and that can then be more widely disseminated within that country or within that region. So the idea here is dissemination. Start small and grow it using a common language and common concepts, which is what's outlined in this guide. Now, it's also so in this way, it's a training package mainly for teachers, but it's going to be relevant also to people involved in organizing administratively how schools are managed, because there are many ideas of how you can optimize well-being through different things than simply language, but also how people interact and having opportunities for kids to interact. And finally, it's an advocacy tool as well. And I'm sure Claudina, Dr. Cayetano will talk a little bit more about that. So as you can see, it starts off with definitions, and then we go into a kind of booklet, which it was mentioned that is dynamic because we have hardcore information, and then we have the kinds of questions that people are more likely to come up with. And so you're constantly interacting between some questions that you'll recognize and some knowledge base that you can use to answer those questions. We tried to use illustrations that were made it easy for people to identify a somewhat familiar school environment where all sorts of things are happening, and it's not that easy to keep tabs. So, this is where you can understand the differences between people and celebrate difference, but also realize when difference has gone awry and where things need to be understood and recognized. So we go through here development. What is it that people develop over the early school age in terms of their attitudes, in terms of their ability to resolve problems, interacting, etc. And as we move through, there's specific developmental milestones that you can find here. in terms of brain development, prenatal development, even brain development, motor development. And obviously, I'm not going to read through this, but it gives you an idea for different age groups, and with an emphasis on the age group that we're aiming for, 6 to 12. And then in terms of influences, clearly there are many influences. Social influences are very important, but the emphasis here is on the influence of school. And so I think that there are notions of what can a teacher do, and what are the not only, besides having information, understanding, and with understanding one reduces stigmatization and increases understanding. That's what breaking down stigma means. Teachers have many possibilities of gaining information and integrating it into their everyday teaching. And, by preventing themselves from acting on their own frustration that may come up, and recognizing how punishment can actually make things worse for children, both from the authorities and from other children, from peers. So this is what we go through. And then we go through a series of disorders, which we don't expect people to become experts in, but to be able to use as a go-to guide to understand what we're dealing with. So I think that that's mainly what I wanted to say this morning, and I don't want to take up more time than this. And Claudina Cayetano, I'm sure, will be able to tell us a little bit more. So back to you, Ave. Thank you very much.
Thank you very much, Dr. Laporta. And thank you so much for taking us through the handbook and providing us with some insights into the evidence that informs the publication. So next we will go to Dr. Claudina Cayetano, Advisor Mental Health, PAHO WHO. And Claudina is going to take us through the next steps of this handbook, of the launch of this handbook and of this project. So we look forward to hearing from Ms. Claudina, please.
Thank you so much, Ave, and I'm so happy to be part of this media launch. So first of all, I'm so grateful to hear the colleagues who had, predeceased in terms of doing the conversation, from Dr. Oliveira to Mr. Dean Chambliss to Dr. Laporta, Ms. Daniel. You're putting together that this is a topic of substantial interest, and it's an opportunity for us to capitalize on the importance of creating this document, this manual, this handbook, which is definitely a learning resource that targeting teachers in primary school. So I'm so pleased that we have engaged the media to take the word, that this exists. And so what is next? What is next is that we need to make sure that we take it to the field and that we give a good, there's a good use to that. As the presentation was, you can use it by itself, you can read that, but we don't want to just having a handbook that can be used without guidance, without support. So we want to be able to learn from the field in terms of lessons learned. We want to work with partners. We want to work with colleagues, like the colleagues from PAHO, from my colleagues from Sonja, the adolescent health advisor, Dr. Cafe, from UNICEF, colleagues at the sub-regional office, from the Healthy Coalition, Caribbean Coalition, from all of you, that this is something we need to do together in terms of preparing the next step. And clearly, the handbook at this moment is in English, but PAHO is the UN Agency for Health for the Americas. And in the Americas, we also speak Spanish, Portuguese, and there's other languages. So our plan is that we will be translating the handbook into other languages. First, we're going into Spanish because, as I mentioned, PAHO is for the Americas. It's not only for one section. So it's extremely important that we also translate the handbook, and we work with, we develop a roadmap in terms of how do we going to be implemented, and looking into selecting indicators so that we are able to show the impact of going into the schools, since this is our first publication that is targeting primary school teachers. So we want to make sure that that is done in a way that gives us the opportunity to select indicators, to monitor and evaluate, and to gather lessons learned clearly if we want to have a version 2 that is now guided by, from the field. I want to stop here in terms of, because we want to be able to give some time to the questions and answers, and my colleague, Dr. Giraldo is coordinating that section. But before we move to that, so let's see the question and answers. Then we have Miss Cheryl to do the thank you. So over to you, Ave.
Thank you, Dr. Claudinia. We do have a question here that I would like to put over to you, Dr. Claudinia. And it is, a study was mentioned by Mr. Chambliss, I believe, in his speech about the increased productivity tied to improved mental health. Did the study also highlight how many children in the region are depressed or suffered from any mental disorders? I hope you don't mind repeating if you did mention it already. Additionally, there was a specific cry about how teachers were addressing was there a specific cry about how teachers were addressing mental health in students? Now, it's 2 questions in one, so maybe we take it one at a time. So the first one is about increased productivity tied to improved mental health, which is a study that was conducted. Did it highlight how many children in the region are depressed or suffered from any other mental disorders?
Should we have about the study? Maybe Dean, you have. Yeah, go ahead.
So if I may, this study came out of the investment case that was done in respect of Suriname, and it generally looked at NCDs and mental health. So it did not go into that into those particular areas to look at the region as a whole. However, the study as it relates to the investment case that has been undertaken in countries such as Jamaica, and we can post the link to that so that you can also have an appreciation of the findings there. It took place in Suriname, which is what Mr. Chambliss had referred to in his speech, and it is now ongoing in Guyana. So it really looks at the country and what is happening from a country perspective. We are hoping to cover additional countries. So later on, there would be a greater appreciation as to the data as a region.
Ave, if I can also, if I may complement.
Yes.
Yeah, it's very important what Cheryl has just mentioned. So we have those studies in the region showing the importance of investing and what you get in return when you invest in mental health, which include investing in mental health at schools. This is very important. And in fact, we are now at this moment updating a review of the literature on the prevalence of mental health conditions in children and adolescents. So we expect that this is a report that will come later during the year with more accurate information on the prevalence of different mental health conditions in the region of the Americas.
Thanks so much, Renato and Cheryl. And I think in your speech, you referred to, Renato, on the statistics in terms of the 20% of youth will experience depressive disorder by the age of 18. And in our handbook, we also mentioned some of these statistics that are quite alarming when it comes to mental conditions. I think Mark referred to those, during his presentation. So we do have some data, and that clearly needs to be updated. And, with the pandemic, we need to be very careful that we do collecting information on what is the impact of, what happened with mental health, especially in children and adolescents. So thank you. Do we have another?
Thank you. Yes, just the second part of the question was additionally, was there any specific cry about how teachers were addressing mental health in students? So anything that exists right now with mental health with students, this person is asking, Dr. Claudinia or Dr. Renato and Ms. Cheryl Dennis, right? Do you know of any initiative or any like cry that teachers are saying that they need like a specific mental health resource within schools?
So if I may, and we probably could talk to you a little bit about the focus group we had, and Mark probably recall that. So what we did, we had a focus group with teachers from the Caribbean, and actually some teachers from Canada. It was interesting to hear the challenge that they're experiencing at the time when we had, hybrid sessions, because remember how we moved from a face-to-face now to hybrid, and then it was all online. So the teachers clearly express their gaps that we have in the education system and the challenges that they have in terms of recognizing. As you know, we're not asking that teachers do diagnosis. That is not their role. Their role is to teach. But we also want to make sure that we provide them some information, some skills, some tools to be able to find, detect conditions that can be managed. So we were very glad to hear them in terms of the importance of having, why we need to develop this guidance. You probably know that in the Caribbean, we have what we call the HFLE, Healthy Life Skills, but it doesn't go in depth into recognizing the signs and symptoms of mental conditions. But let me stop here because I think it will be good to also get the feedback from Mark regarding the conversation that we had with some of the educators.
Yeah, I think that what we're seeing is that educators are very sensitive. Those that we spoke to, and I think that they were representative. We chose educators as much as we could who were particularly interested in interacting with their students and who had a good sense of how their colleagues interact as well. And these are people who are quite active. And it's interesting how they are very good at feeling that something is happening, and they're very in a very difficult position very often because, for example, their own lack of understanding and knowledge makes it difficult to know when something should be done. And they're quite worried that maybe if they do something, it might actually be highlighting the difficulties with it. Like, it's a little bit like when we had the talk on suicide. Do you talk about suicide? People said, we better not talk about it because we'll make it worse. In the same way, teachers are often quite concerned that, if you start talking about a difficulty and maybe getting some help, maybe you make it worse. So it was quite interesting to see how they are, in a way, in the middle of the sandwich. They're feeling and seeing and experiencing what's going on, and both the lack of knowledge and not only lack of knowledge about mental health and mental illness, but the lack of knowledge of what the resources are. And so one of the plans is to, when these trainings are going to happen, is to also facilitate the lines of referral. So to have people understand better, what do you do in these cases? Do you just talk with an expert? Do you refer? So, this is what we're experiencing. This is not, so I'm not giving you a statistical answer because it was a focus group, but it sounded like this was a problem that was quite generalized. Knowing how to go beyond being stuck in your teacher bubble and not knowing how to open up in a way that will be useful both to you as a teacher and to the student. I hope that answers the question to some extent.
Thank you very much, Dr. Claudinia and Dr. Mark. Please, anyone, if you have any more questions, thank you so much for your questions thus far. Please just put it in the Q&A box, or just raise your hand and we'll be able to see you. Thank you.
I can probably read one of the from the Q&A. and say, and I'm reading now, I am Shifan from Family Wellbeing Center, Sri Lanka. We work on stopping early onset on substance use in Sri Lanka. We would like to use this handbook. Thank you so much, Shifan. We're glad to know that you like the handbook, and it was created for that purpose, that it can be used, but we also want to make sure that there is a guidance in terms of how it is being used in school. But thank you for letting us know that you will be using the handbook out of the way in Sri Lanka. Over to you, Anne.
Thank you. I believe that I believe we've come to an end to the Q&A, that everyone has had their questions in. Yes?
Can I just ask can I ask one question to to Claudina and Renato? I think this is now published, right? People can actually access this publication, can they? Yes.
Yes, they can.
So I don't know if that's been indicated somewhere, but it might be interesting for people to be able to leaf through it.
Yes, thank you, Mark. It's we include, thank you, Lisa, our colleague Lisa Bailey, include the link to the handbook. It is on our PAHO publication website. So it can be accessed. What we do in the media launch, so that, you know, the word can be taken out there, and then from that we'll be working very closely with the ministries of health as our partners, and Ministry of Education, as I mentioned before, with colleagues from UNICEF, just joining, putting it together a small group to work in terms of the implementation at the country level. And then, of course, you know, the planning for us to translate the handbook into Spanish. Thank you. Renato, you may want to add something.
No, that's exactly it. Thank you, Claudine.
Thank you, Dr. Claudinia and Dr. Renato. And indeed, Lisa has put the link to the handbook in the chat. So please go there to access it. And we would like to close this morning's ceremony with closing remarks by Ms. Cheryl Dennis-Wright, International Consultant, Non-Communicable Diseases and Mental Health at PAHO WHO. And I also wanted to introduce the new focal point for non-communicable disease attached to the PAHO WHO Sub-Regional Office, who is Ms. Gloria Geraldo. I see that she turned her video on so everyone could see her and she could say hi.
Hi, good morning, everyone. And it's just a pleasure to participate in today's lounge and start meeting all the colleagues and partners in the sub-region. Thank you very much.
Thank you, Mr. Aldo. It's very nice to have you on board. So we will move to Ms. Cheryl Dennis-Wright, International Consultant, who will give us the closing remarks.
Thank you so much, Ave, and all our colleagues who, who spoke earlier and who gave an input. So I really want to give sincere thanks to all of you also for attending, and to all our panelists for sharing. I think it's essentially safe to say that we are not leaving here the same way we came, as we have really garnered a greater sense and appreciation for why we need to promote the mental health well-being in schools, how to use the handbook, and we have a greater sense of the handbook as an advocacy tool and how we can use it really to advocate for mental well-being. Please pardon me and allow me to specifically mention some persons. So the handbook would not have been possible, of course, without the sustained commitment of the Sub-Regional Program Coordination for the Caribbean, the Mental Health and Substance Abuse Units of PAHO WHO, and of course, the collaboration of the WHO PAHO Collaborating Center for Research and Training in Mental Health at the McGill University and the Douglas Mental Health University Institute. So let me specifically mention, because this is such a big deal, not just based on the work that was done, but also on the impact that we know will accrue from this. The support provided by Drs. Mark Laporta and Dr. Massey Ori on the content of the associated materials, Ms. Laura Harancha and Emmanuel Perez from the InkLink, who realized the adapted handbook and coordinated the work of the illustrator. I want to mention Ms. Helen George and the graphic designer, Mr. Kwame Bises, And we also want to thank for the overall guidance provided by Mr. Dean Chambliss, Dr. Renato, who spoke earlier in this session, Ms. Annabelle Martin, who acted as coordinator for the project at the PAHO WHO Collaborating Center, Ms. Chelsea Chin, who assisted in all phases of the development of the contents. We want to specifically mention Ms. Isabel Kenyon, who contributed to the progress also, throughout the progress. And there are some other persons who contributed in terms of the review, Dr. Asha Pemberton, Dr. Sonia Cafe, Dr. Matthias, and representatives of the PAHO Youth for Health group. They also participated in the focus groups, and the consultants and advisors, of course, who gave their contributions in the different phases of the projects. Finally, and certainly not least, Drs. Claudina Cayetano, who spoke earlier, the advisor in mental health, and certainly Dr. Elisa Prieto Lara, the previous advisor on NCDs and mental health, who really facilitated the birth of this remarkable project, which no doubt will be carried out in the next phase, or will be continued in the next phase by Dr. Gloria Hiraldo, who was just introduced to you, who is succeeding Elisa. Now, several other persons who are not mentioned here, leading up to this publication, yourselves, and we just want to let you know that we sincerely appreciate it. We recognize that the handbook is not only a resource and an advocacy tool, but that it represents a valid response or support to the challenges that we see in the Caribbean. Now, of course, the fruits will only be realized where we actually utilize it. So we encourage you to ensure that you access it and ensure that you promote it. Claudina has already spoken on the next steps, and we're really thankful that NextGenu, is partnering with us on the next steps as we even look to, at a later date, translating this into other languages. And just be assured that consideration is really to have another webinar at a later date where we can share the information on the handbook and engage, of course, a wider network of partners. And we're also pursuing the development of an online curriculum, having regard to the contents of the handbook. So we thank you. We also want to thank UNICEF, who we have already started to have additional discussions with respect to the reach of this handbook. So thank you so much for joining us, and we look forward to collaborating and engaging with all of you in terms of promoting this handbook. Thank you.
Thank you so much, Mr. Ernest Wright. And this is truly an expert team collaboration. So congratulations to everyone who was involved in this publication. And thank you so much to everyone who took the time out to join us this morning. And if you have any further questions about this project, please feel free to contact us via email. It could be me or Lisa, and we will definitely reach out to you with any responses that you may need. So I just want to draw this launch to a close, and thank you everyone for joining, and please enjoy the rest of your day.